Hello, so this is part two of joint movement for healthy gait and balance. It's important at all times, basically, to remember core stability and strengthening, specifically the obliques, transverse abdominis, and glute maximus. The more we can learn to facilitate these structures and show our clients how to facilitate and activate these structures, the better. By having a strong core, obliques, glute maximus, we decrease a lot of stress on the low back and the other secondary structures. So the muscles of the hip no longer have to compensate as they commonly do related to a weak core. So the hip joint itself can move more effectively. This is going to then create a more ergonomic articulation and movement at the knee, down into the ankle, down into the foot. So all of this ends up relating, and I mean, frankly, all the way up into the neck and shoulders too, for a good cross-body pendular movements so that we're moving effectively as well. Regardless, this video is going to focus predominantly on foot movement and strengthening of movement. So with any mobility, we need stability. And by stability, we also need some capacity for strength. So the most common compensation we will see is people will have limited big toe extension, rigid hypomobile arches of their feet, and limited dorsiflexion. So I'm going to stand up and I'll show those movements and ways in which we can help strengthen and reinforce those, right? Okay. All right. So let me get myself in position here. Now, let's go ahead and just start with some general freeing up motions. This is something that I've seen in Tai Chi and multiple movement patterns. Nothing big. If you look at how much I'm picking up the heels of my feet, just tiny. Feels like I'm just kind of bouncing the heels of my feet on the ground. Leveraging at the forefoot off of my toes, particularly the big toe. This can be just a nice way to just kind of shake everything out, even related to you can see my wrists flopping around, but shoulders and what have you. So with that, kind of shaking the legs out. Now, specific movements. The toes. We should learn, if we can, to learn to spread and open the toes up. And I've worked on this a lot, and it's hard to do. Getting good at one, bringing the toes up into extension and spreading and pulling them apart. Not doing a great job, but I'm trying. But you can feel it. I can feel it in the arch of the foot. I can feel it in the metatarsals itself. It's easier when in flexion, in plantar flexion, to create some space and distance. Between every single toe, if I could AB duct and AD duct, all the better. So a challenge that even I face off with a great deal. The more dexterity we have with the toes, particularly being able to open them up into abduction, the better. Anyhow, flexion extension patterns though, just gripping the floor, gripping the ground with our toes can be a good way of just helping facilitate the strengthening, right? Getting even more specific, if I turn my foot out a little bit into inversion and think more about just bringing from my second to my fifth metatarsal, so not my big toe, just squeezing the ground with all my little toes. Then switch, and I go into more of an inversion. Or eversion, sorry. So anyway, about big toe. So there's flexion, the flexion patterns. People in my experience tend to be too strong, too dominant in flexion at the toes. And we need to work more on extension. So just picking the toes up off the ground. And we can get a good visual on this too. Either we can feel in our own body if one side feels harder than the other to lift. But just doing these toe, I mean, we can accomplish this by standing in gravity while we're waiting in line, what have you. So toe extension movement, incredibly important. Paying attention to if one side feels more hypomobile, then we need to challenge that side and keep it pliable. Now, anytime somebody has balance related issues, then I always suggest having a cane. You can always bring a chair in to create stability, just even a wall to lean on. But we can start to reinforce this whole toe strengthening and pliability, mobility element by just getting into a staggered stance to begin with. Now this back foot, if I just bend my knees, so I get about 1 or 2 feet in terms of breadth, one leg and hip into hyperextension, one at flexion, and bending the knees in such a way that I just begin to feel tension at the Achilles, just starting to feel a little bit of a stretch at that back Achilles. And then here, and I just do both feet because why not? Here, doing toe extension and flexion. The muscles of that flex, some of the muscles that flex the toes go up behind the Achilles. So creating some shear forces there is very helpful. So flexion, extension, flexion, extension. Then I can pick up my heel, and now I'm going to be reinforcing. If I push off, that's of course going to create some flexion here. You're not going to see me worry too much about strengthening flexion of the toes. If I just pick my foot off the ground now from this position, and then if I can just look for, I want my weight to be mostly isolated over the big toe. Feel a little bit of stretch right there at the big toe into the bottom of the foot. If I want to exaggerate it, then I just bend the knees. Stand up, knees fully locked out, knees flexed. Less of a stretch at the big toe, more of a stretch at the big toe. Very simple. Then switch, do it all over again. So staggered stance, bend knees, feel a little tension at the Achilles, toes back and forth. And up onto the ball of my foot, bend, feeling a little stretch into that big toe. We need that big toe extension so that we can push off and then clear the ground. Along with plantar and dorsiflexion, the big toe needs to move in and out of extension and flexion so that we want to clear the ground and don't trip, but also have enough strength to push off and help lift our whole leg out of gravity. Now, with eversion, inversion, supination, pronation, the best strategy I frankly have is not dissimilar to what I was saying about going into inversion, eversion. But now I'm just not worrying as much about the toes. The thing about feeling like I'm mostly positioning my weight on the lateral sides of my feet and then the medial side. If I want to get a touch more nuance, make sure my knees are unlocked, and I want to feel like I'm actually exaggerating the arch of my foot and then flattening the arch of my foot. So I'm trying to illustrate using my hands. So I'm shifting my weight to the lateral sides of my feet, and then I feel my arch shortening. And then I shift my weight more to the medial part of my foot, and I feel my arch spreading out and flattening. So shortening, flattening, shortening, flattening. Now, with that, we then shift to dorsiflexion and plantar flexion. This can be probably the most important exercise I show. And I know it looks simple, But I tell you what, if there's one thing people lose, it's dorsiflexion. And you can get a clear read regardless if they're wearing shoes or not, based on how well they're able to clear the ground. So you can see which foot is lifting higher up compared to the other. And then that can give you a lot of good information as a pre-assessment and post-assessment. So just dorsiflexion. Don't tell people don't use their knee. Don't let them go into extension of the knee, because that's a common compensation pattern. That's why people will start getting knee-related issues in response to losing dorsiflexion. Your body will compensate to find a way to clear your leg off the ground so you don't trip over yourself. So tell them to make sure knees slightly unlocked as they produce this movement. Otherwise, this is a common dynamic. They use their hips and their knee to produce what looks like dorsiflexion. Anyway, dorsiflexion. Then with plantar flexion, if there is some balance related issues, then best maybe to start with a staggered stance and just kind of do a rocking. I can produce in one foot, I can think dorsiflexion. I'm going to get some knee extension when I do this. I can just rock back and forth. Again, people don't have as many issues with related to plantar flexion. I usually find I'm trying to help them strengthen and facilitate dorsiflexion more than anything. So this is a good movement. As you can see, it kind of combines many aspects of what we're going to see as we move more and more into the gait cycle. But if one can, and sometimes I save this, at least for myself, as the last thing I do in a movement program, is being able to just get up on to my toes. So, and I feel like I'm walking around like a dinosaur, you know. But the ability to walk around and be stable on our tippy toes is in itself a pretty good balancing exercise. Wouldn't want to do that all the time. But when we do this, however, it can't be that when I get up on my toes, I'm feeling the weight distributed away from the big toe. You see how my knees went outward, turned lateral, my hips externally rotated? That's a giveaway that I'm not using the right structures. When I get up onto my toes, my weight should be most on my big toe. That's the only way it's going to facilitate the right kinds of balancing reflexes that we want for a good gait swing. When we walk and or run, we do not want our whole leg pivoting in rotation much. There's a swing element that is tied in with rotation, but the big toe stays in line with the direction of where we're moving. It's a lot of lost energy and potential joint strain when we're trying to when we plant our foot in external rotation or even too much internal rotation. Neither is ideal. Your big toe should be pointing where you are moving. So in meaning that that's going to be one of the primary contact points. In running, for example, front foot strikers need to be thinking about striking predominantly with that big toe. So if you are trying to do the advanced movement of this and coming up into plantar flexion at the ankle with your toes, the weight needs to feel like it's predominantly on the big toe. And this is quite the exercise if you do it, obviously, enough reps of them. But getting yourself set, getting up onto the big toe, controlling that movement, and controlling your way back down into dorsiflexion. So now, as I bend my knees, I am then going to dorsiflex at the ankle as well. I have to when I'm standing on these legs in this closed kinematic chain. So one of the best things I can show or do for myself is getting up onto my toes, specifically the big toe, and then being able to control my deacceleration back down. So flexion at the hips and knees, dorsiflexion at the ankles, then come out, extension at the hips, knees, up onto the big toes. Down. Plantar flexion, dorsiflexion. Plantar flexion, dorsiflexion. That, if one can work their way up to it, is the best thing I can offer in relation to the multiplanar movements at the foot. Now, if need be, again, using a chair or something to help push and lift, I might use this arm. If I had 2 chairs, 2 canes to help stabilize myself, I probably would suggest 2 chairs. That'd be more stable to help reinforce this movement. Should be smooth. We don't want to be hurting ourselves doing stuff that's supposed to make us feel better, right? Good. So those are really the most important ones. Think about just incorporating toe movements and strengthening into everything that we can do, and remembering that we want to strengthen as well as maintain mobility and pliability. Oftentimes we tend to do a lot of self-massage, rolling the arches of our feet on a tennis ball, what have you. But incorporating just simple things like this: eversion, inversion, learning to be able to get up on our tippy toes effectively, and thinking about dorsiflexion. Incredibly important. If I had 2 things that I do the most for myself, it's this, the dorsiflexion one, and getting up on the toes. If I'm trying to combine these motions all into one, then it's doing this kind of back and forth. One foot's the heel striker going to a midfoot. The other one is the rear foot with the big toe going into extension. Flip it around. So, simple, nothing crazy, just thinking about the big toes, dorsiflexion. It's good for you.